Hello, NeedyMeds users and friends. Thank you for joining me. My name is Carla. I am the Director of Education and Partnerships at NeedyMeds. And today I'm going to teach you how to find healthcare savings resources on the NeedyMeds website. Before we get started, I'd like to go over a few tips so you can make the most out of today's presentation. First of all, if you have any questions, you can feel free by typing them into the questions section of your GoToWebinar control panel. Just know I will reserve answering questions until the end. If I don't get a chance to answer your question, I will follow up with you via email. But of course, I will provide the contact information for both NeedyMeds and my contact information as well at the end. Also, this webinar is being recorded and will be available on our YouTube channel. And you can find a copy of the PowerPoint slide deck I'm using in the handout section of your control panel. So let's get started with what is NeedyMeds. NeedyMeds is a national nonprofit founded more than 2 decades ago by a retired family physician, Dr. Rich Sagel. Rich is still the president. On your screen is all of our formal wording for our mission statement, a statement about how we achieve our mission, and our vision statement. But simply put, NeedyMeds connects people to programs that will help them afford their healthcare expenses. And we do that free and anonymously through our website, needymeds.org, and our helpline, 1-800-503-6897. And one of the most important and popular ways that we help people save on their medications is with our listing of prescription assistance programs. Prescription assistance programs are usually supported by pharmaceutical companies and most of the time offer free and some of the time offer deeply discounted prescription drugs, usually name brand to those that qualify. Of course, not every drug will have a prescription assistance program. When a program is available, eligibility requirements and applications will vary from program to program. One common requirement is that the patient's healthcare professional usually needs to be involved by providing a prescription, signing the application, and submitting documentation. So, how can you find prescription assistance programs and other healthcare savings resources on the NeedyMeds website? Well, bear with me while I transition out of my PowerPoint onto the NeedyMeds live site so I can demonstrate. So as you can see, there is a ton of information on our website. Since we're going to spend today's webinar checking out savings resources under this Patient Savings tab, I encourage you to explore our site further when you have time. For now, I just want to point out a few other resources you might consider looking into. On the top right-hand side, you will see the third icon from the left with the rest of the social media icons is a link to the NeedyMeds YouTube channel. I'm pointing that out because, as I mentioned at the beginning of the presentation, this webinar will be converted to a video to be added to the NeedyMeds YouTube channel. So we suggest subscribing so you can stay up to date on the latest videos, webinars, and presentations. Also, I encourage you to check out the Advocates tab. This is where you can sign up for our monthly newsletter or email alerts, order print materials, and check out other upcoming webinars. You can also see what other webinars are scheduled by checking out the calendar of events on the bottom right hand of our homepage where my mouse is hovering, again on the bottom right side. And I am also really proud to point out that just last week we added an entire new category, the COVID-19 Resource Center. This database is full of programs for those experiencing financial hardships and struggling with healthcare expenses due to the COVID-19 coronavirus. And of course, we'll talk a little bit more about that later on. So let's get back to those prescription assistance programs. Now, first of all, you can always begin your search for a savings program by typing in the name of the medication, generic or name brand, into that drug search bar on the top left-hand side. If you are specifically looking for prescription assistance programs, we're going to go ahead and click on that Patient Savings tab. And as you can see on the top left, that's where all the patient assistance resources are listed. And right at the top, you will see a link for all of our prescription assistance programs that you can find in a number of ways. You can find them in probably the least common by looking for the company or program name, or by the most common brand name drug hyperlink. So I'm going to go ahead and click on that brand name drug hyperlink, because let's go ahead and try and find a prescription assistance program for a brand name drug called Eliquis. So I'm going to go ahead and click on that hyperlink. And the first thing that happens are a bunch of icons pop up. What these icons do is they tell you what type of information is available for that drug. Is there a savings program available, such as a prescription assistance program or a coupon? Is there more information available about that medication through, for example, support pages or a drug video? You'll also notice this convenient A to Z index. That will make your search a lot easier. So obviously, I'll choose the letter E for Eliquis, click on that hyperlink in the alphabet bar, and then I'll scroll down to see if that medication is listed. When you do see, let me make the screen a little bit bigger. When you do see the medication listed, it will be hyperlinked. Go ahead and click on it. And there are those icons again. The three on the right-hand side let you know there's more information available about Eliquis. This will link you to the drugs.com page. This icon means that there is a video about this medication. And this icon indicates that there are support pages, which are additional hyperlinks to provide you more information about Eliquis. The two on the far left are savings programs. This icon indicates there's a coupon available. And the very first one on the far left indicates that there is at least one prescription assistance program available. I'm going to go ahead and click on that because it is a hyperlink. And right at the top, you can see in this blue bar, there are currently 2 prescription assistance programs available for Eliquis. And you can see that because it says program 1 of 2. Now, the reason I say currently is because programs change all the time. That's important to keep in mind, because if you are looking for a prescription assistance program and you don't find one, it's absolutely worth checking back a few weeks or a few months later. I also want to point out, if there is more than one prescription assistance program, like there is in this case, we will always list the program that offers the most assistance at the top and then the less assistance at the bottom. So I'm going to make the screen a bit smaller. Don't worry about reading the text just yet. I just want you to see what a snapshot of that prescription assistance page looks like. And hopefully you'll agree all of the pertinent information is right on your screen. And then as I scroll down, you'll see it's separated by that blue bar to let you know you're moving on to another prescription assistance program. So I'm making the screen a bit bigger so we can talk about the information that's here. So right at the top, not surprisingly, you'll find the name of the organization that is supporting or sponsoring this program. And right underneath that, you will find the contact information. And that's really important because if you have any questions about the program, you're going to want to call the program directly as opposed to NeedyMeds. Next is the application section, where pretty much always you will find a hyperlink to the application itself. In the rare case that is not there, you will simply find instructions about how to obtain an application. Let's next talk about the most important eligibility requirements section. And as I mentioned in the beginning, eligibility will vary from program to program, but it's almost always based on 3 factors: insurance coverage or insurance status, residency, and income. And income is often based on a certain multiple of the federal poverty guidelines. Now, a lot of times, a couple of things I want to point out. People won't check to see if they are eligible for a prescription assistance program because they make the assumption that if they have insurance or drug coverage, that they will automatically not be eligible. And as you can see, that's not always the case. And oftentimes, they may not bother to apply because they feel like they make too much money. And again, often that may not be the case. It's worth checking out, is my point. I'm going to scroll down so we can get a snapshot of the eligibility requirements for the next prescription assistance program. And as you can see in this case, in fact, you cannot have insurance to apply. But again, it does vary from program to program. And before I forget, I do want to show you how easy it is to figure out what your income is for eligibility requirements using the federal poverty calculator. So I'm going to go ahead and click on it. So let's say we have an individual, and you can see I use sort of the same examples over and over, but let's say we have an individual that makes $47,500 a year. You'll notice I only typed in the digits, don't type in the periods, commas, or dollar signs. And that's, excuse me one second. Sorry about that. And that is the same number you would put on your tax documents at the end of the year. Let's say this individual is supporting a family of 3, and that's all the information you would need. Hit calculate, and the results indicate that this individual's yearly income is 218% of the federal poverty guidelines. Now, when we return to the eligibility requirements, as you can see, this individual clearly qualifies. And that's great. We hope that's what happens every time. But what happens if the calculations show that he was not eligible? Maybe he found himself just above the eligibility requirements at 305 or 310%. Well, when that happens, don't despair. If your income is slightly over the income limit, apply anyway and ask the program to make what's called an economic hardship exception. At that point, if you're denied, you can always officially appeal. Now, again, I'll remind everybody, if you do have any questions, you can feel free to type them into that question section of your GoToWebinar control panel. A couple of other things I do want to point out before we move on from prescription assistance programs. Always be sure to check all of the information on the page. The application section will let you know important details like if or how your doctor needs to be involved and how long it will take to get a decision from the program as to whether or not you're eligible. The medication section is important also because it lets you know details such as where the medication will be sent to, and how to reapply. And always check out this additional information section, because that's additional important information that we need you to be aware of. It just doesn't fall neatly into any of the other categories. And one more quick thing about prescription assistance programs before we move on to other cost savings programs. When you return to that patient savings tab, on the far left, you will see a section for help filling out a prescription assistance program application. Now, sometimes applications can be complicated. So if somebody needs assistance helping to fill out an application, they can find one here in their zip code or broadly by their state. So just keep that in mind. Now, returning to that patient savings tab, let's talk about the $4 generic discount drug program. This is a directory of all discount programs for generic medications available at major retailers. Most do range in price, even though it's called a $4 generic drug discount program. They do range in price from $4 to up to $15 for a 30, 60, or 90-day supply. And as we scroll down, you can see there are a number of ways you can search. You can search for a specific participating store or pharmacy. You can search for a particular drug, but you can also search for a specific state. So let's see what's available in Arizona. So the results indicate that there are currently 5 stores or pharmacies participating in the $4 generic discount drug program. And I hope you'll agree that all of the important information is on your screen, including the name of the participating store or pharmacy, a hyperlink, if available, the name of the program, and most importantly, on the far right column, the details about what the program provides. And you'll notice there are a lot of there's participation from a lot of the major chains, such as Walgreens, major national chains, such as Walgreens and Walmart, but you will also see more local pharmacies participating as well. So be sure to visit this site if you are looking for help with affording a generic medication. And before I move on, I just want to get to a question somebody asked, I believe, about whether or not the income is solely based on last year's income. So the prescription assistance programs, again, although eligibility will vary from program to program, when they're asking for income, they are usually asking for the most recent income. So it usually is based on the most recent year, which is usually the former year from which you apply. So do keep that in mind. But if you find yourself in a situation where your taxes from the previous year are showing you made more than this year, I would go ahead and submit the application anyway, and then again ask them to make an economic hardship exception. Whatever you do, I would absolutely suggest reaching out to the program directly, asking that question to them, and making that case. So I just wanted to get to that question before we moved completely away from prescription assistance programs, because I thought it was an important one. Now, moving on, another really popular destination on the NeedyMeds website is our free, low-cost, and sliding scales database. We've broken this database up into 4 categories to make your searches easier. You can search for medical clinics or dental clinics, but you can also search for mental health clinics and substance addiction clinics. These are all set up exactly the same way. So for purposes of this presentation, I'm just going to go ahead and click on medical clinics. As you can see, it's a pretty big category because we have just under 17,000 free, low-cost, and sliding scale medical clinics in this database. And you can search for one in your area a number of ways. You can search really specifically by your street address. You can search by only your zip code, or you can search really broadly by state. So let's go ahead and do a quick zip code search. So bear with me. I'm going to go ahead and type in, let's see, a zip code where NeedyMeds is located. And let's say the individual has transportation. So I'm going to do within 10 miles of that zip code. And as you can see, there are 4 free low-cost or sliding scale clinics in the 01930 zip code. And there's all the information we think you'll find helpful, including the name of the clinic, their contact information, and a website if one's available. The eligibility, which lets you know who can be treated at the clinic and can they expect to incur a fee, and if so, what will it be? And the far right column lets you know details, such as the services that clinic provides. The reason that's important is because many clinics offer additional services beyond primary care. And this one right at the top is a perfect example of that. In addition to primary care services, they also have a dental lab, they have substance addiction assistance, they can do some testing for you. So it's absolutely worth checking out. Now, although we do pride ourselves on the information on our website being accurate and up to date, we always recommend reaching out to the clinic, giving them a call, checking out their website to confirm things like their hours of operation, what their fees are, do some of the staff speak different languages, and any other thing you think will prove helpful before you make that trip to the clinic. Now, let's say you wanted to print out this list and keep it for yourself or share it with the patient or loved one. You can do that. You can click on the print all option and it will print out all 4 clinics that we just found. Or you can choose only the ones you'd be interested in by clicking on that little box above the map option and choose the print instead of the print all option. And it'll do just that. It will generate and print a list of only the ones you chose. So let's go ahead and return to that patient savings tab and talk about another way to save, which is with the coupons and rebates section. And bear with me one moment, guys. Hang on for 1 second. Apologies for that. Some technical difficulties working from home. Thanks for hanging in there with me. So we were talking about the coupons and rebates section. And this is where you can find prescriptions and over-the-counter medications or supplies for which there is a coupon, a rebate, a savings card, a free trial offer, or a free sample. Just like in the other sections on our website, you can search a number of ways. You can search by the brand name of the drug. You can search by the name of the product. But in this case, you can also search by category, which, as you probably guessed, does mean medical category. So let's click on that so you can see the list of all of the medical category options. And from that point on, it's pretty self-explanatory. Please do check out this section of our website and be vocal about your experience. You can shoot me an email anytime you have some feedback to contribute or offer. The reason we recommend that is because we consider anybody that uses a website a partner, and we don't know how to improve it unless we get feedback from you. So please don't hesitate to get in touch with me. And of course, I'll provide my contact information at the end. And this also lets me say that hopefully at this point, you're seeing that the NeedyMeds categories on our website are set up similarly, and that's purposeful. We want to make the website as easily negotiable as possible so you and your clients or your loved ones can find what is needed within a few clicks of your mouse. I also want to point out that if you don't have access to a website, a computer, a phone, or the internet, don't hesitate to give, or another reason you might give us a call is because you simply would rather speak to a human being. So don't hesitate to reach out also to our call center counselors at 1-800-503-6897, and we do have Spanish-speaking counselors. Another question that's coming in, I'm going to take a moment to answer this, is whether rebates and coupons can be used in a hospital setting or just retail. That's a great question, and I hate to give this answer, and the answer is it will depend on what the coupon says. It will absolutely specify in the fine print on the coupon where you're eligible to use it. So do keep that in mind. I would say most of the time it would be accepted just at retail settings, but that would not be a hard and fast rule. So check out the information that comes along with that coupon. So now, aside from the prescription assistance programs, the second most popular destination on our website is our diagnosis-based assistance program section. This section provides financial assistance for costs associated with a particular diagnosis. Now, this section is different because for the most part, it doesn't include medicine. Mostly, it includes other necessary medical expenses that are associated with a particular diagnosis. Maybe somebody needs help affording medical equipment or medical supplies or assistive technology. Like the other categories, you can search a number of ways. You can search by diagnosis. You can search to see what's available geographically. If you're familiar with the program name, you can search by that. Or you can search really specifically to see what's available in your state for a particular service related to a particular diagnosis. Now, for the purposes of this presentation, I'm just going to show you what this section looks like by choosing a diagnosis. Now, because this section of our website is so broad, again, like the prescription assistance program section, we did put together an easy A to Z index. I'm going to go ahead and click on the letter D for diabetes. And as you can see, because diabetes is a broad category, it's broken up into more than one category. I'm going to go ahead and click on the general hyperlink for diabetes. The reason I like to use diabetes as an example is because not only is it such a common diagnosis in our country, but it is also a great example of a diagnosis that often requires a lot of costs in addition to medication. A lot of time diabetics are looking for things like testing strips, syringes, or medical supplies. And as you can see, there are currently 78 diagnosis-based assistance programs for those living with this diagnosis. And like the other databases, I hope you'll agree that on your screen is a snapshot of all of the pertinent information, including the program name and a hyperlink on the left-hand side, a summary about that program, and the two far right columns are what you're going to be most interested in: the services provided and the areas of service. Now, the services provided will vary from program to program, and what you're looking at on your screen is a great example of that. Oftentimes, they will help you afford medical supplies or assistive technology, but these programs below it will help you get some respite care or access to a service animal. So again, it does vary greatly. Now, the areas of service mean where do you have to reside to be eligible? And you'll keep seeing the word national over and over. That's because we put all of the national programs at the top. What that means is that regardless of where you reside in our country, you are eligible to apply. And then underneath the national programs, you will find all of the states listed alphabetically. Now, returning to that patient savings tab, right underneath that, in that center section, there is our brand new category for our COVID-19 Resource Center. Like the other categories on our website, you can search a couple of ways. The most common being, I would think, by program, but finding a program according to geography. You can find it what state you live in. But also, again, if you are familiar with a particular program, you can always search by the program name. And again, this section, I had a chance to mention the very beginning, this category in our website specifically helps with healthcare costs and financial hardships for those impacted by the current pandemic. So let me show you what this looks like. You simply click on, let's say you want to see what's available in your state. You'd click on the search by area of service, and just let's see what's available in California. So currently, California is already offering 12 services or programs for people impacted by COVID-19 coronavirus. So again, do check this out when you have some time. Now, returning again to that patient savings tab, I'm not going to spend too much time on the other categories because hopefully at this point you're starting to see how our website is set up. I just will bring to your attention, let me make the screen a bit smaller. So under that patient savings tab, you'll also see sections dedicated specifically to assistance with medical transportation costs. You can find retreats, camps, recreational programs, and educational scholarships for people living with specific diagnoses. And you can also find government programs available in your state. And this government healthcare programs category is also helpful if people are interested in learning more about their Medicare or Medicaid benefits. So do check this out. Now, I'd like to switch back to the PowerPoint so I can review another important way that you can save on your medications and healthcare costs, which is with the NeedyMeds drug discount card. And again, if you do have questions, don't hesitate to type them in to that question section of your GoToWebinar control panel. So let's talk about our drug discount card. The NeedyMeds, and I'm sure you've heard of other drug discount cards. Ours works the same. You simply match up your drug discount card with your prescription, go to the pharmacist, and see what savings you can get. Now, the NeedyMeds drug discount card differs, though, from other drug discount cards because ours is free and anonymous. What that means is we do not track your personal data, so confidentiality is guaranteed. There is no registration, no enrollment, no residency, and no activation, and it is accepted at more than 65,000 pharmacies nationwide. And you can use the drug discount card to save up to 80% off the cash price of prescription medications. You can save on over-the-counter medications or supplies as long as they're written as prescriptions. And you can even save on human equivalent pet meds purchased at a regular pharmacy. You can also use the drug discount card to save 40% off medical equipment. And the big question is, who can use this card? And the simple answer is anyone. The only rule is it cannot be combined with insurance. So if you are uninsured or don't have drug coverage, you can use the card anytime. If you do have insurance, you can choose to use the card instead. And what you're looking at on the screen are some of those reasons you might choose to use a drug discount card instead. So let's go ahead and transition one more time from the PowerPoint back to our website so I can show you how to get your drug discount card. You won't be surprised that under that patient savings tab, there's a bunch of links to our drug discount card in the top left-hand side, on the bottom right-hand side, but you can also, they all take you to the same page, which is, as you can see on the left-hand side, right on our homepage with that red arrow, a link to get your NeedyMeds drug discount card. Now, this page is where you can request your drug discount card. You can print out a downloadable PDF. You can fill out the form, being sure to choose a design. Probably the least convenient way, but still an option, is you can mail us a self-addressed stamped envelope, or you can also reach out to our call center counselors at 1-800-503-6897, and they're happy to drop some in the mail for you. So now you have your drug discount card. The next thing you want to know is what pharmacy in my area accepts it. Right on that drug discount card page at the very bottom, there's a pharmacy search. You simply type in your zip code and it'll let you know what pharmacies in your area do accept the NeedyMeds drug discount card. So now you have your drug discount card. You know what pharmacies accept it. And the last step is how much will your medication cost using the drug discount card? And you can find that out by clicking on the left-hand drug pricing calculator. And to find that out, you would need 4 pieces of information. You would need to know the pharmacy zip code where you would like to pick up your prescription, the prescription name, the dosage, and the day supply, meaning is the prescription for 30, 60, or 90-day supply. With the pharmacy tracker and the drug calculator, you can find out where to pick up your medication and what you will be paying before you head out the door. And again, of course, if you don't have access to the internet or call center counselors, internet or call center counselors can find out this information for you. And on the bottom left-hand side, you can always download, there's a link to explain how, the NeedyMeds Drug Discount Card app. It's free through Google Play or iTunes. So now I'm going to transfer once again out of the live website to our PowerPoint presentation so I could get to some of your questions and bring a few other things to your attention. Here is a snapshot of our other upcoming webinars over the next handful of weeks. Don't hesitate to check out ones coming up later in the year, and to learn more about what these webinars are about, you can check out our calendar of events, again, on the bottom right-hand side of our homepage, and you can also register there. And I want to go ahead and get to some of the questions coming in. And as I do that, I want to leave up our contact information. Of course, there's our website and our toll-free helpline. I put my colleague Alana's contact information up there because if you are interested in ordering some of our drug discount cards, a bulk supply, or some of our brochures, you can reach out to her, or you can always reach out to me with that request, and certainly if you have any questions regarding this webinar. So let's get to some of those questions coming in. The first one is, and we do get this one a lot, how does NeedyMeds support itself? And that's a great question. And you can actually find the answer to this on the top right of our homepage, the very top right. You'll see a little About Us section. And in there, on the same page that has our mission statement, you can see the sources of financial support that we rely on. Now, like other nonprofits, we do rely on corporate and individual donations and grants, but we also do license fees for our organization's use of our databases. We do sell a software called PAP Tracker that helps clinics simplify the prescription assistance program application process. We do get a small transaction fee on every use of the NeedyMeds drug discount card, and we do have thoroughly reviewed supporting partners on our website. So another question coming in is, I believe, about our drug discount card, whether I know offhand if retail pharmacies get reimbursed if a patient uses this card. I know some drug discount cards that don't get reimbursed. So that's a great question. And for those of you, if anybody's interested in learning a little bit more, doing a little bit more of a deep dive about how our drug discount card works, we do have a webinar, pre-recorded webinar on a YouTube channel called Demystifying the Drug Discount Card. And it gets into the nitty-gritty of how it works. But our drug discount card, my understanding is pharmacists do not get, I wouldn't use the word reimbursed. The way ours works, and I think this is true for others, but certainly not all, is NeedyMeds works with an adjudicator or pharmacy benefits manager, and they negotiate prices with the pharmacy. So those negotiated prices are just an accepted price, but my understanding is there isn't a quote-unquote reimbursement. But thanks for the question. Oh, and great, we have somebody asking about the software. So if you work for a clinic or organization or with a group where you're regularly helping people to find and apply for prescription assistance programs, manually submitting those applications and tracking them can really be an administrative burden. So we have created a software called PAP Tracker, PAP Tracker. It stands for Prescription Assistance Program Tracker. And again, it's a software that eliminates the administrative burden of manually submitting and tracking those applications. If you are interested, you can shoot me a message in that question section, and what I can do is I can put you in contact with my colleague who will happily provide you with a free demonstration, more information about PAP Tracker, and let you know how much it costs. So let me know if you'd like, anybody in our audience, if you'd like to learn more. And you can certainly read a little bit more about this if you go to that Advocates tab on our home site. I think on the left-hand side under that Advocates tab, you will see a link for PAP Tracker. So you can learn a little bit more about that there. Thanks so much for the question. Oh, another great question coming in is, you mentioned you can use the drug discount card to save on pet meds. How? So I'm glad that came up because actually tomorrow, I believe, we do have a live webinar on how to use the NeedyMeds drug discount card to save on human equivalent pet meds. And the reason I say human equivalent is because oftentimes, depending on how you look at it, our pets take the same medications as we do, or we take the same medication as our pets. The presentation tomorrow is really brief. I think it's about 15 minutes, so please do take the time to do that, to watch it if you are able. If you miss it, you can always check it out on our YouTube channel after we've converted it to a video. And again, I suggest subscribing to our NeedyMeds YouTube channel so you don't miss out on any webinars you're interested in. Oh, so here's another great question. Can I help support NeedyMeds COVID-19 efforts? So thank you so much for even thinking to ask that, and it gives me an opportunity to say an enthusiastic yes. We would appreciate and certainly can use the help. And there are about 3 different ways I would say that you can help. One is simply by spreading the word. Let your clients, patients, loved ones, neighbors know that NeedyMeds does have a database of about 150 resources for those experiencing financial hardships or can't afford their healthcare costs due to this pandemic. It's about 150, but as you would imagine, that number is growing every day, if not by the hour. So regularly check that back and spread the word. Another way you can help is by simply letting us know about a program. If you're aware of a program that you don't see on our website, we would be more than happy to list it. And again, you can simply shoot me an email. And of course, if you are in a financial position to do so, you can always donate. There is no amount that's too small, and you can donate by clicking on that Donate Now button. You can't miss it. It's right at the top right of our homepage. It's pretty big. So thanks so much for asking for that. So I do try to keep the question segment brief, so I'm going to wrap it up with one last question, which is an easy one, which is what time is the NeedyMeds call center open? So I'm happy to let you know that, yes, our call center is open and remaining open, and we are open 9 a.m. to 5 p.m. Monday through Friday. But keep in mind we are located in Massachusetts, so that is East Coast time. So again, that's all the time we have for questions. If you did ask a question or leave a comment that I didn't have the chance to answer, I will follow up with you via email, or again, you can always reach out to our call center counselors. Thank you again for taking the time to join me today to learn about NeedyMeds. We do hope you join us for future webinars. Stay safe and have a great rest of the day.